My name is Kevin. I'm a student physical therapist, and today I'll be palpating on Jacob. Jacob, is it okay if I palpate on you? Yeah, perfect. So our first landmark we're going to be palpating is the C2 spinous process. I'll be first going from the external occipital protuberance, which is right about here. I'll be moving inferiorly until I feel that first little bump. That's going to be your C2. C2, if I have Jacob flex the head, I won't be able to feel it as much just because of that nuchal ligament, and if he extends, I'll be able to feel it more. I won't really be able to feel C1 just because it goes in, it's kind of that space. But C2 is the axis, but the interacts with C1, which is the atlas to create that axial joint. C2 has the dens, it's going to be right over here.
Or C6, C7.
C6, C7.
Spinous process.
Spinous process. So I'll be going down from here. C7 is really that big protuberance here. And then I'll also be able to go up one to palpate C6. If I have Jacob flex his head and extend it, I'll be able to feel that C7, which is right here. C7 doesn't really move with it, and I won't be able to feel C6 when he flexes the head. This is a good landmark for the rhomboids and the traps as they insert onto this process.
Articular pillars and facet joints.
Cool. So the articular pillar and facet joints. So if I go back up here and I palpate for that spinous process, right here, and I just go laterally, then I'll be able to find those pillars. It's where the paraspinal muscles insert into, and if I go a little bit more laterally, I'll be able to feel these bumps, which are the articular facets. And these facets are what interact with all the other spinal vertebrae.
First rib.
All right, so first rib, coming down on top of the traps and moving down and anteriorly till I feel that bony infield. It's going to be your first rib here. This is a flat bone or a flat rib, and the subclavius muscle attaches from like the clavicle to the first rib, right over here. Okay.
Spine of the scapula.
All right, so spine of the scapula. I'll first be I'm going to move on this side. I'll first be popping with my palm onto the acromion process here. And then from here, I'll be able to come across this way. And I can feel, just follow like the bone across here. So this is the spine of the scapula. You have your supraspinatus on top and your infraspinatus on the bottom right over here. And it's also a attachment point for the traps and the deltoids. Inferior angle of the scapula, I'm going to have Jacob bring his arm back. I'll be palpating down the medial border of the scapula. Going to be right over here until I feel that part where it kind of curves and comes back. So that's going to be your inferior angle of the scapula. Going medially, it's a good landmark for finding your T7 spinal vertebra right over here, and it's also an attachment point for your latissimus dorsi muscle. Thank you.
AC joint.
All right, so the AC joint, we're going to be coming back to that acromion process, so using my palm right over here. And then you can also follow the clavicle here as well to this, where they kind of join together. That's going to be your AC joint. So your AC joint is a landmark for kind of stabilizing like the clavicle and the scapula, and it's also a common site for shoulder separations. If you were to fall like on your shoulder, your clavicle would be coming up superiorly.
Subacromial space.
All right, so subacromial space, we're going to be coming from the acromion, and we're just going to go inferiorly down this way until we feel kind of that space right here. And that's going to be your subacromial space. So your subacromial space has bursa in it. Also has like your tendon for your long head of the biceps and your supraspinatus. And it's a common site for shoulder impingement.
All right, greater tuberosity.
Cool. So greater tuberosity, it is like the most prominent of the humerus, where you can use your palm. It's going to be like the most lateral and anterior prominent. So you can feel it right over here. This is going to be your greater tuberosity. This is a good site for a lot of the rotator cuff muscles to insert to, so like your supraspinatus, infraspinatus, teres minor. And if you go medially a little bit, you'll fall into that bicipital groove.
Coracoid process.
So coracoid process, I like to go here. It is the coracoid process of the scapula. So going from like the acromion, I just go a little bit medially and a little bit down here, and I can feel right here. It's a little like ball-like shape. Bone, but you can feel it right here. It is a attachment point for the coracobrachialis, short head of the biceps, and your pec minor.
Medial and lateral epicondyle.
Cool. So medial and lateral epicondyle. I first like to start on the shaft of the humerus, coming down. And then going from the like lateral supracondylar ridge, we can just follow it down to the lateral epicondyle. So the lateral epicondyle is a common site for your wrist extensors of the forearm. You also have your radial collateral ligaments here. And then same thing for the medial epicondyle, going down the shaft of the humerus to the medial supracondylar ridge, and then down to the medial epicondyle right over here. Common site for your wrist flexors of the forearm, and you'll find your ulnar collateral ligament here as well.
Perfect. Radial head.
So radial head, I like to go from the lateral epicondyle, this space back here, and then I also follow just the shaft of the radius up. My thumb will be in the cubital fossa. Then I'll use like my middle finger and my index finger to kind of get a grasp of that radial head. And if I have Jacob internally rotate and externally rotate, I can feel that spinning of the radial head, and that's how I know I have it. Another thing too with this is it's a common site for that injury, the nursemaid's injury, where if like the arm is being pulled out as a child, the radial head will be pulled out from that annular ligament.
Scaphoid bone.
Cool. So scaphoid bone will be from the hand. I actually like to have Jacob kind of extend his thumb, and then I'll go down the radial head here. In this anatomical snuff box, if you push deep and you feel that bony end feel, it is the carpal bone of the scaphoid. This is a common site for injury if you do like the foosh mechanism, so falling on an outstretched hand. You'll see a lot of the times they'll call it a wrist fracture, but it's really fracturing the scaphoid.
Triquetral bone.
Triquetral bone. So another bone of the carpals. I like to go from the ulnar shaft down to the ulnar styloid process. And if you just go fall right off of that, you'll land on the triquetrum. If you go on the palmar side, you'll be able to actually feel the pisiform, which sits right on top of it. If I have them radially deviate, you can really feel that triquetrum pop out.
Knee joint line.
Knee joint line. I'm just gonna have Jacob. Cool. So for the knee joint line, I like to go from the patella and just follow it down to like the apex of the patella here. And then from there, just kind of go laterally, and you can kind of feel like that space. It's the knee joint line, like right over here. If I have Jacob internally rotate, you can actually feel the medial meniscus pop out. And if I have him externally rotate, you can feel the lateral meniscus. Another thing too, if you go more laterally or medially, I guess, you could say, once it kicks you out, that's kind of where you know that you have your medial collateral ligament or your MCL. It's that kind of flat wide band. And then on the lateral side, same thing here. It would be a more ropey structure, but you can feel like your LCL. All right, so we'll be popping the fibular head now. So I'll be using my palms kind of coming down here. And you can really feel like a big bony protuberance right over here. This is going to be your fibular head really laterally. So right over here, it's a attachment point for the biceps femoris, as well as like your LCL. Okay, so right now we'll be palpating the ASIS. So I'll be using the palms of my hand, kind of going from like the top of the iliac crest. I'll be first palpating that, and then kind of moving down. When you really feel that like two bony landmarks that really pop out, you can kind of use your thumbs to really get a specific spot on it. So the ASIS is a attachment point for the sartorius. That comes down to the pes anserine, and then you also have the inguinal ligament that goes into the pubic tubercle.
Femoral triangle.
So the femoral triangle, I'm gonna have actually Jacob, if you could bend and bring it over here. I'm just gonna have him adduct his leg because I want to feel for that adductor longus, which is the medial border. Go ahead and adduct for me. Perfect. Okay, so I got it right here. You can relax. So the three borders of the femoral triangle, which I can pop it right here, it's going to be the sartorius that we talked about, the inguinal ligament that we talked about, and then you have your adductor longus. Within this space too, you also have the navel, so the nerve, artery, vein, and lymph that goes from lateral to medial.
Liver.
So the liver, for the liver, we're using the palms of my hands for just kind of like the bottom of the rib cage, and the liver kind of sits just a little bit superior, rather than this rib cage a little bit deep. So you're gonna have to dig in, but just use like the pads of your fingers. So I'll be pushing in, and if I have Jacob breathe in for me, you can kind of feel that firm and feel that's gonna be your liver right there. The reason we palpate this is to really check for any like masses, anything with like cancer, but it's also like a site for bioproduction.
Talus.
So the talus will be coming down to the ankle. I can use this one. So I'm just gonna have Jacob bend his knee. So the talus What I like to do is palpate the medial and lateral malleolus. The talus just kind of sits right over here, right between that. So if I have Jacob dorsiflex for me, you can kind of feel that talus disappear, and then when you plantar flexes, it'll pop out a lot. So you have the talus right here. Talus is a really important part of the ankle and foot. There's 2 joints here. So you have your calcaneal, or like your subtalar joint, talo or transverse tarsal joint, and the talocrural joint, or like the true ankle joint there. That's your talus.
Navicular tuberosity.
So navicular tuberosity, we go from the talus, and we're going to move down to the navicular, which is going to be like that next bone down, and then you just go medially till you feel that bony protuberance. So the navicular tuberosity is the attachment site for the tibialis posterior, inserts into here, as well as the spring ligament goes from the sustentaculum tali to the navicular tuberosity.
Base of 5th metatarsal.
Cool. So base of the 5th metatarsal, it's going to be on the lateral side. So you go kind of like from the shaft of the 5th metatarsal, which you can feel here. And then there's also going to be like a bump that goes down. So right at that bump is going to be the base of the 5th metatarsal. It is a insertion point for like your fibularis brevis or your fibularis tertius muscle, as well as a common site for an avulsion with like inversion ankle sprains.
ATFL.
Cool. So ATFL comes from it's the anterior talofibular ligament. So if you can palpate again, like you find your talus here, and then you can see the lateral malleus is like the fibula. It'll just come down here, and you'll be able to like, it's a pretty easy ligament to palpate. You can feel it right over here. It is one of the ligaments that help stabilize the ankle, as well as like probably the most common ligament that gets sprained with the ankle sprain.
Greater trochanter.
Greater trochanter. So I'm gonna have Jacob, if you can go on your side for me, please. So again, I'm gonna be using my palm to palpate for a bony structure just right on the side of the femur. And then I actually like to have Jacob, if you can internally rotate and externally rotate for me, you can actually kind of feel that bone. So I can feel it right over here. Thank you. It's gonna be your greater tuberosity. So it is an attachment site for like your gluteus medius, like your hip adductor muscles, right over here.
PSIS.
PSIS. Okay, so I'm gonna have Jacob go prone. Okay, and is it okay if I just pull on your shorts a little bit? Thanks. So for the PSIS, I'll be starting with my palms, and it's gonna be the posterior superior iliac spine. So then you can kind of feel these 2 bony prominences right over here. That's gonna be your PSIS right over here. So your PSIS, if you go immediately, it's like a good reference point for your S2 spine, as well as the sacroiliac ligament attaches there.
Sacrum, ILA.
Sacrum ILA. So for the sacrum ILA, you start at the PSIS, go immediately till you find that S2. Then you can kind of go down, and then right where that sacrum kind of bends and has that like curvature, that's your sacro ILA, so your angle, inferior lateral angle, right over there. And the sacrococcygeal ligament attaches there.
Ischial tuberosity.
All right, so ischial tuberosity. Jacob, if you can, I'm just gonna have him extend here. I'm just looking for that gluteal fold. Okay, so I'm gonna go down there. And then I'll just be with my fingers kind of away. I'm using the palm. I'll be kind of palpating up for that bony prominence right over here. So you can feel that ischial tuberosity. It is like your sit bone, so when you sit down, that is the bone that you sit on, as well as an attachment point for a lot of the hamstrings.
12th rib.
12th rib. So 12th rib, you can come down here, palpate here, using like the palms down right over here. So your 12th rib is one of the floating ribs, as well as if you go immediately and you like kind of follow it up to the spine, you can kind of feel for that T12 spinal vertebrae.
L5 spinous process.
L5 spinous process. So again, I like to use the PSIS as my reference point here. So right over here, going immediately to the spine, you'll find that S2, and then you just kind of follow it up until you can feel kind of like something that you can push up on from underneath going up. That'll be your L5, which is the biggest vertebrae in the body, and it does a lot of like the takes a lot of the weight bearing load.
Mm-hmm.